The average age for type 2 diabetes diagnosis in kids is actually 14.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with Dr. Natalie Davis, co-founder at PreventScripts. Natalie, always good to see you.
Great to see you, Logan.
So, we do these interviews every year. I've gotten to watch PreventScripts grow and develop and expand. It's been really exciting to see you move into and expand in the primary care space and help doctors with folks that have chronic diseases. So, tell us where you're at 2024. What is PreventScripts?
Thanks so much, Logan. Well, as you know, at PreventScripts, we help primary care providers identify risk for metabolic conditions like diabetes and hypertension. What has surprised and excited us is our customers have let us know that they have need for hypertension interventions as well as downstream interventions for hypertension, diabetes, as well as heart failure. So we're very excited to work on some strategic co-development projects with our partners to encompass that downstream heart failure intervention as well as the upstream preventive interventions.
Okay, so talk to me about the use case. Talk to me about what it's like for the primary care doctor. You've got a lot of folks they're trying to take care of, a big patient population. What was it like before? Let's just take somebody you're working with. They're dealing with folks with metabolic diseases. How has their care shifted with PreventScripts?
Think of the typical primary care doctor is seeing patients yearly for a yearly checkup or an annual wellness visit if they're a Medicare patient. And they're doing their best. Lots to deal with, lots to do in a visit, and trying to get that lifestyle advice in there. Drink more water, eat more fruits and vegetables, walk more, do all these things.
In 10, 15 minutes? How long do they have?
Very quick visit, in a 10, 15-minute visit, and sort of then you go home, good luck, see you next year. And what tends to happen in that year, we know that as the blind spot of healthcare. This is the time that patients are going home. It's not that they forgot everything the doctor said, but it's that they're sort of realistically and functionally unable to carry out this multifaceted advice, and remember everything in that visit. They go home, they live their life, they come back, their disease has progressed, and often into full-blown disease during that blind spot.
That's obviously terrible for the patient, but it's also terrible for the provider, the doctor. How do they feel? I mean, you're a practicing physician. How does it feel for a doctor to send somebody off knowing that there's this big black hole?
Right. It's very frustrating, and we're trying to meet patients where they are on the one hand, but the way we're giving this advice, this sort of we call it kitchen sinking, and that's what I did in my practice. I would kitchen sink these patients, and what you have to do to actually change behavior is you have to pick one behavior at a time to focus on. And so what happens after PreventScripts is that patients are able to assess their own risk at the point of care, pre-visit.
Okay, on your website?
On a pre-visit link that goes out to their cell phone, and they're able to see their risk for diabetes and hypertension in a nice color-coded interface on their mobile phone, co-branded with the primary care practice, so they know it's coming from their doctor.
Okay.
And then the primary care providers are able to onboard patients into interventions that match their behavioral stage of change as well as their metabolic condition. It could be diabetes. It could be hypertension. It could be both. It could be heart failure. It could be that the patient just has a slightly elevated BMI and they're eligible for a preventive intervention, like a hypertension prevention program.
But it's very personalized.
So trying to personalize the intervention to the patient and customizing it according to the patient's stage of change. Some patients aren't ready to change their behavior yet.
Who pays for this? Because highly personalized care seems expensive. Margins are thin for primary care. So how are you handling that?
We have a platform with particular codes that match each phase of our product. One is a behavioral profile. Payers are very thrilled to pay for these preventive codes. there's not a payer that's not interested in all of these things happening. They want to prove outcomes. They might not pay for remote monitoring interventions forever, but they will pay for a 6-month trial. If the patient has a 5+% body weight loss, they will continue paying for the full year, wanting to see a 10% weight loss by the end.
So what I hear you saying is you're working with prior existing codes.
Prior existing code.
Building out the workflows to make it easy for the primary care doctor to use those codes.
Right. We do create pro formas for our customers to look at their existing contracts, what's in fee-for-service, what's in value-based care, and match up our platform codes to their contracts to see the actual performance and help them with performance over time.
Okay. Are you focusing regionally? Is there a play to kind of scale up and go broad with this?
We are working mostly in a multi-regional work at this point. We live in the middle of the Robert Wood Johnson obesity states in the Southeast, and so we're really
the opportunity is plentiful.
Yes, the red states with the worst obesity rates, and so we're looking at Kentucky, Tennessee, Alabama, Georgia, Louisiana, Missouri.
Plenty of regional opportunity.
Yes,
but a large region.
Yes.
Okay, very interesting. Recent milestones that you're excited about?
We are excited to be up for an award today, the Rising Star Award for Digital Health.
Okay. At the Digital Health Hub Award.
The Digital Health Hub Awards, Rising Star, and interestingly, for kids' health. So we were a little surprised by that, but our platform does span from age 12 to 74.
Okay. Well, it sort of speaks to, you deal with folks who might be dealing with obesity, early type 2 diabetes.
Yes.
And
the average age for type 2 diabetes diagnosis in kids is actually 14. So it is a very fulminant disease that progresses to end organ damage very quickly.
Okay. So how are doctors responding to this? It feels like, we talk a lot about burnout. We talk about, physician well-being. It feels like for them to have a tool would make them feel a lot better about seeing these patients. What are you hearing from doctors?
One of the things we hear from our customers, and one in particular in Kentucky, she has told us, I am going to put all of my patients on this behavior profile before I will prescribe them GLP-1 drugs. So she's using PreventScripts as the carrot to gain adherence to eating less sugar, drinking more water, eating more vegetables. And if they're adherent to the profile, and this is very simple, it takes 5 minutes in the morning, 5 minutes in the afternoon, then she'll prescribe GLP-1 drugs at their follow-up visits. So we've been excited to see that.
Interesting. So GLP-1 become a lever for just better compliance, which is going to help across the board.
Right. And oftentimes, we see patients will start on our platform and the providers will prescribe GLP-1 drug. It'll be denied. And then there's an authorization process, and then it'll go back and forth. It's 6 months later. But if they're doing our intervention, we're seeing behavior change and we're seeing weight loss. And in some cases, the patients get to the point that they're finding success on their own using our program, and they decide they don't want to do the GLP-1 drug at the end of the day.
Do you primarily work with independent practices, small, mid-sized practices, or do you work with hospital systems?
We've added some partnerships this year working with group purchasing organizations, and we're able to offer our platform through to their membership through the GPO sale. And that's exciting for us because it allows us to scale more quickly.
Yeah. Very nice. Well, Natalie, it's been awesome to see your products grow. I've gotten to speak with some of your clients, just physicians on the ground in Kentucky working with these patients day to day. And so I just appreciate that you're giving them a new tool to help tough patients. So thank you.
Thank you, Logan.
Keep up the great work. Take care.